मैं बात ध्यान से
Okay, so in IVF, जब embryo transfer होता है, the doctor will never say ready to go just by looking at the external genitalia. Okay, so यहाँ पे the doctor is just looking at the external genitalia and saying that we are ready to go. Okay, so that's not the fact. In embryo transfer, we are ready to go when the endometrial thickness on ultrasonography is between say 8 to 12 millimeters. So anything between 10, 11, 12 millimeters is very good. So whether we are ready to go or not depends on the levels of the hormones, the progesterone levels, and also the endometrial thickness on ultrasonography.
In vitro fertilization का ये last procedure है embryo transfer. It is the most critically important procedure. चाहे terms of cultural environment की पहले बच्चे नहीं आ सकते थे. लेकिन अच्छी
So Kareena Kapoor is getting very much frustrated and angry looking at the interns, and the poor interns as usual. सब जगह से scolding मिलता रहता है, seniors चिल्लाते हैं, doctors are shouting. At least Akshay Kumar is a little bit sympathetic towards interns, saying बच्चे हैं, that's okay, give them a chance.
Turning on the outer line, yes, sir. Is it normal? Yeah, it's absolutely normal. It could just be a reaction to the medication. Doctor, मुझे anesthesia दे दीजिए. मैं बेहोश होना चाहती हूँ. Relax, Mrs. Batra. मैं यहाँ
Okay, so generally, again, a swelling in the outer lining, ऐसा you don't see on the external part. That's just ऐसे intern ने कुछ बोल दिया है dialogue. The other part is that absolutely correct. We generally for ovum pickup, the step before the embryo transfer, as all of you know, the ovum pickup that is done under anesthesia, where we put in the needle and suck out the eggs. The embryo transfer is not done under anesthesia. So doctor is correct in this part, at least saying that we will do this without any anesthesia because it's really not required.
मैं चाहता हूं कि आप सारे नेगेटिविटी को अपने अंदर से बाहर निकालो क्योंकि उसका असर एम्ब्रियो पे होता है. और अब मैं एक प्रेयर बोलूंगा. आप ध्यान से सुनिए और आंख.
I think very mean to the embryologist also, doctor. The person जिसने वो catheter लाके दिया is the embryologist and is a very important person who takes the eggs, who takes the sperms and does the actual process of mixing the egg and the sperms, or if it's ICSI is done, single sperm is picked up and injected inside the oocyte. So all that part is done by the embryologist. And then he loads the embryos in the catheter and gives it to the doctor. So यहाँ पे जो embryologist था, ही बेचारा वो आया and doctor was very mean to him. गंदा सा look दिया उसको and वो भी थोड़ा depressed होकर चला गया. And this part is at least correct that negativity should not be there. Patient should be absolutely relaxed while undergoing the embryo transfer and even after that.
सारी पॉजिटिव एनर्जी को इस एम्ब्रियो में ट्रांसफर करें. तुमने इतना ये किया. Oh, mother of life. No, sir. Maybe repeat them. नहीं, आप सिर्फ सुनिए. Okay. Oh, mother of life.
Okay. So one very big mistake, of course, doctors can and patients can say the prayer. That's not a problem. But before transferring the embryos, loudly patient name, husband name, embryo, all that is shouted. That this is the embryo transfer being done for Mrs. XYZ. The husband name is XYZ, wife name is ABC, whatever, and this is the couple, and this is the embryos of Mrs. ABC and XYZ. So every loudly it has to be said, so there is no goof up, and actually that was the goof up which actually happened in the movie. I'm sure आप सबने देखा होगा.
O Father of the universe, bless us with the gift of a child, with the gift.
Yeah, so this was very accurately shown. अच्छा दिखाया था. The catheter is going and under USG guided. So embryo transfer should always be done under USG guided. Embryos are transferred. Now, how many embryos do we transfer? Okay, this could be asked to you. So remember, generally, we never transfer more than 3 embryos and 2 to 3 embryos, 3 max upper limit, because we don't want multiple pregnancy triplets and other complication. And nowadays is also a trend of single embryo transfer. So we grow the pregnancy outside till the blastocyst stage and the blast transfer. So single embryo transfer or single blastocyst transfer is very good, or at the most 1 or 2 or max 3 embryos are transferred.
The gift of generations and the gift of love. Congratulations. The procedure.
Again, very mean to the embryologist. Please, no doctor should hit or this. This is just for, I think, the effect they've said. But embryologists do play a very important role. And the doctor was really, I felt really mean towards embryologists as well as the interns. Okay.
Procedure has been successfully conducted. 14 दिन के बाद हम pregnancy test करेंगे. लेकिन तब तक आपको अपना बहुत ख्याल रखना होगा. Remember.
So after 14 days, the beta HCG test is done, because beta HCG will become positive earliest, and serum beta HCG will tell us whether there's pregnancy or not. And one value beta HCG positive, we also repeat after 48 hours to see whether the jump is taking place or not. And lots of injections and medicines in the form of luteal support. So progesterone injection, progesterone suppositories or progesterone gels are also given to the patient to support the pregnancy. That's called the luteal support.
इस एम्ब्रियो का सबसे बड़ा दुश्मन है स्ट्रेस. स्ट्रेस बिल्कुल नहीं लेना और एक्सपेक्टेशन को ज्यादा नहीं. अगले 14 दिन का समय इस प्रोसीजर के लिए सबसे मुश्किल और क्रूशियल समय. So be absolutely calm.
Yeah. So as it was said, that the stress definitely affects the outcome of IVF, and therefore we tell the patient to be relaxed. Easier said than done, but stress definitely has an adverse effect on the outcome of IVF. So this was just our attempt to show you one of the IVF procedures, and with this I'm sure you will also remember things for long term. And if very quickly, I would just quickly say the 3 main steps of IVF. One is ovulation. We stimulate the ovaries by giving HMG injections or gonadotropins. That is, the multiple injections are given. The next step is the ovum pickup or the oocyte retrieval, done under anesthesia. The eggs are sucked out, and then the eggs and the sperms are mixed together. IVF ICSI is done, embryos are ready, and then the embryo transfer step is done under USG guided, which was shown to you in this movie. Okay, so I hope all of you enjoyed this, my reaction video, and it's an attempt to teach you something as well as so that you remember things in a fun way. And definitely please do subscribe to the app, where all these topics are covered in great detail. And I can assure you that once you see my videos, OBGY will become your favorite subject, as well as it will become your most scoring subject. So best of luck, and also do subscribe to the YouTube channel.